Yesterday, Cabinet met to discuss our plan to reduce the threat of Omicron to New Zealand as we accelerate our booster program. And we've received further advice on that overnight. Omicron is now in more than 70 countries around the world, and last week we too detected that variant at our border here in New Zealand. All evidence so far points to Omicron being the most transmissible variant yet, and public health advice suggests that soon every case coming in through our border into our managed isolation facilities will be the Omicron variant. Our immediate job right now must be to slow it down and to delay it from entering the New Zealand community for as long as we possibly can. So Cabinet has agreed to a suite of precautionary measures which I'm going to outline now. So first to boosters. We already know that boosters, the booster vaccinations significantly lift an individual's immunity, reducing the spread and the severity of Covid-19. The advice from our Covid-19 Technical Advisory Group is that shortening the period between the second dose and the booster dose of the Pfizer vaccine is an appropriate and pragmatic step that we can take in line with what other countries are doing. Data is emerging now that booster doses of Pfizer provide better protection than 2 doses do when it comes to the Omicron variant. While it appears that 2 doses is likely to hold a good degree of protection against severe disease from Omicron, a 3rd dose is likely to offer greater protection against transmission of Covid-19 and also reducing the chance for severe infection. So yesterday, Cabinet endorsed the decision by the Director General to reduce the time frame for people to get their boosters from 6 months after their second dose to 4 months after their second dose. That means that around 3 million vaccinated New Zealanders will be eligible to get their boosters before the end of February. That's 82% of everybody who's currently fully vaccinated. The shorter time frame will start in early January. Initially, people will be able to walk into vaccination clinics, and then subsequently, once the Book My Vaccine system is fully updated, later on in January, they'll be able to book in, and we'll set out specific time frames for that as soon as they've been confirmed. Importantly, the schedule ensures that those who are harder to reach within our community, particularly parts of the Māori population who have only recently been fully vaccinated, they'll be able to get their booster doses before winter when the threat of the virus is at its greatest. We remain open to the science and whether we reduce that gap down further will be very much informed by that. Cabinet also agreed in principle that where workers are required to be vaccinated, this mandate will now also extend to booster doses. So initially, it will be for those workers who are most likely to come into contact with Omicron, our border and our health workers. They'll be required to have their boosters by the end of January, or not later than 6 months after their second dose for those who have only recently been fully vaccinated. It will then apply to all others covered by a vaccination mandate from the 1st of March. Secondly, we turn to the border. Since the start of the pandemic, we've worked really hard to provide as much certainty as we can for people who are travelling and who are needing to travel. But as everyone will appreciate, certainty is sometimes hard to offer in a very uncertain situation. Cabinet has decided to push back the date for self-isolation for those travelling from Australia from the 17th of January to the end of February so that we can accelerate the rollout of that booster program and have as many people boosted with their vaccination before we have people isolating at home across the international border. Around 3 million New Zealanders will be due to get their booster by the end of February. And assuming most of this group get their booster on time, at that point we will be far better protected from Omicron. We know that this delay will be disappointing news for those who have booked travel or who are expecting arrivals from Australia. But with the march of Omicron and New South Wales now expecting to be recording 25,000 cases a day by the end of January, opening the border in mid-January as planned simply presents too high a risk at this point. In addition to those measures at the border, the requirement for travellers to New Zealand to return a negative pre-departure test will reduce from 72 hours before departure to 48 hours before departure. When we introduced that requirement, testing was not as widely available as it is now, and people should be able to get their tests within 48 hours. In terms of our MIQ stays, they're currently 7 days, followed by 3 days of self-isolation at home with a negative day 9 test. That will be extended to 10 days in managed isolation with a negative day 9 test. That precautionary measure has already been in place for passengers on flights where an Omicron case has been identified. And thirdly, to the vaccination of our 5 to 11-year-olds. Following MedSafe's approval of the paediatric dose for children aged 5 to 11 last week, Cabinet has confirmed that our vaccination rollout for this age group will begin on the 17th of January. We'll take the lessons from our initial rollout and we'll apply them here, including reaching more rapidly into remote or hesitant communities and providing vital information to parents and caregivers as an absolute priority up front. While vaccination of children will always be a choice made by parents, I can't speak strongly enough in the interests of our collective safety for children as the last unvaccinated group in New Zealand, and for the older people and more vulnerable people in their lives, particularly their grandparents. I can't speak strongly enough of the importance of vaccination. Countries around the world are now rolling out vaccinations to this age group, and I want to underline that it is safe and it is necessary. Finally, to the traffic light system and the decisions that we made earlier this month, which remain as they were at that time at the moment. Cabinet did confirm yesterday that in the event of community cases of Omicron, the first response will be to use the traffic light framework rather than the previous alert level settings. In moving to the Covid-19 protection framework, or the traffic light system as it's commonly known, we did signal that we'd be adjusting to more of a reactive stance when it came to protective measures, and that we would apply those additional restrictions and those additional protective measures as case numbers grew and the health system came under pressure. Omicron has changed the dynamic again. When it does arrive, we expect that it will spread fast, and that's what we're seeing in other places. So to slow that spread, we may use that red traffic light setting earlier on in order to try and slow that spread. That'll give us the best chance of minimising the chances that we'd need to return to something more restrictive. It's not our intention to move to lockdowns unless that is absolutely necessary in the event of a widespread outbreak where our health system comes under considerable strain and the overall health risk becomes too much to bear. And even then, our strong preference would be for any lockdowns to be highly targeted. Faced with alternative courses of action and looking at overseas jurisdictions, Cabinet is strongly of the view that this is the best approach. By keeping Omicron out for as long as we can, we increase the likelihood that businesses can stay open and we can keep our plans for summer in place. For people who want to travel overseas or to come home, we are aware that today will not be welcome news. But it's important to set these changes out as clearly as we can, as early as we can, so that people do have time to consider their plans. As COVID-19 keeps throwing new curveballs in our direction, we have to respond in a way that continues to protect the lives and livelihoods of New Zealanders and avoids putting in place restrictions and lockdowns unless they are absolutely necessary. While I know everybody wants certainty, certainty has been a rare commodity for the whole globe through the entirety of this pandemic. What I can say with certainty this afternoon is that we've got a system that's been built to adapt to new challenges and one that will go the distance. Today we've further strengthened the settings which will continue to carry us through the next wave of challenges around COVID-19 that we expect Omicron to throw up.
So as the Minister has said, in the light of experience overseas and emerging evidence with Omicron, the Director-General has recommended that the interval between the second dose and the booster dose be advanced to 4 months. This is to ensure that everybody has the opportunity for a booster dose before winter next year. We've recommended as a committee that that booster should be offered to adults 18 years or over after the completion of that primary two-dose course. Priority, of course, as it was in the initial rollout, should be for those at risk of exposure to COVID-19 or at risk of severe disease once contracting COVID-19. So this includes particularly Māori and Pacific peoples, those aged 65 years and older, and those with pre-existing medical conditions that puts them at higher risk from severe outcomes. Just thinking about our elderly, since the start of the pandemic, There have been over 900 people aged 60 or over diagnosed with COVID-19, and in this more recent outbreak that started in August, just over 500 cases have been documented in those over 60 years of age. As you know, our Māori population has accounted for a high proportion of cases in the current outbreak, so improving vaccination rates and the addition of a booster is the best way we can protect this population. Our frontline border and healthcare workers are also a top priority, as they were in the early part of the Pfizer rollout, and so the addition of that booster is the best way we can protect them, particularly with the cases appearing in MIQ over the last week or so. So because we started our rollout in that group, our border workers, healthcare workers, and of course older people and those, as I've mentioned, with pre-existing conditions are in fact already eligible for a booster. We're in a good position now across the country with 95% of people over 65 fully vaccinated, including high rates for Māori and Pacific. District health boards have active outreach for boosters to residents in aged residential care who are also at greater risk, and are planning for vaccinations to be offered for new residents who move in over the coming weeks and months. So far here in New Zealand, over 216,000 booster doses have already been administered. That's around 60% of those who are currently eligible. The Ministry has advised that boosters for people aged 18 years and over who have had their second dose at least 4 months ago will be available in the new year.
The Māori paediatricians that I've been working with welcome the government's decision to make the paediatric vaccine available for tamariki aged 5 to 11 years. This is an important decision, particularly for tamariki Māori, who would likely bear a disproportionate burden of this disease without the protection of vaccination. We believe tamariki Māori have a right to be protected against COVID-19, and they have a right to participate in the wider protection of their communities. Māori paediatricians have provided technical advice in the lead up to this decision, along with other Māori health professionals and Māori organisations. We've specified that a successful vaccination program for 5 to 11-year-olds will be a program for whānau, one that allows parents and caregivers to receive reliable information and discuss that information with people they trust. One that engages effectively with whānau of tamariki with disabilities. One that allows whānau to access other vaccines on the routine vaccination schedule. And COVID boosters for young people and adults. A successful program will be delivered in partnership with iwi and Māori health providers, including sharing of data. Māori and Pacific organisations have already demonstrated that they know how to deliver vaccination programs effectively in their own communities. As Māori paediatricians, we're encouraged to see the government making a commitment to by Māori, for Māori input, including ongoing technical and implementation, communications and delivery of vaccinations.